In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time.
Remember that day, March 11th, 2020, one of those days and moments in history where you likely remember exactly where you were when the spread of COVID-19 was declared a pandemic by the World Health Organization. That was 5 years ago. And now a new book edited by Dr. Laura Hawryluck, Pandemic Voices, Unheard Stories from the Front Lines, chronicles the tales of that time. Doctor, welcome to CB24 Breakfast. Thank you for joining us. I read several of the different essays and excerpts from this book last night. And, you know, as a journalist who spoke to a lot of doctors, you know, throughout the pandemic, I felt like I had a pretty good sense of what was going on. But this really rips back the curtain in many instances and really shows the dark and grim reality doctors, nurses, medical practitioners were facing. You know, when you read this, this must just be so vividly stuck in your mind.
You know, it really is. I close my eyes and I can still see what our hospital, what our ICU, where I work, what that looked like 5 years ago. Especially the book came into, you know, being conceptualized after the Delta wave, right when we were entering the Omicron wave. So a lot of our authors spoke to their experiences in a very honest, very transparent, really from the heart about those moments lived behind the headlines. And this is what we have in this book from authors around the world. And I couldn't be prouder of them for really ripping back that veil and opening up to us.
Who do you think should read this book?
I think it's a book for everyone. You know, we call it Missing or Untold Stories from the Front Lines, but really we were all the front lines. And while it includes stories from healthcare workers, it also includes stories from people in the community, from, you know, members of healthcare teams that we don't always hear from, like spiritual care pharmacists, from members of the business community who are struggling to initiate businesses to try to help us in this time. And I think, you know, it talks about what we learned, some of the heartbreaks, the challenges, but really what it was like to step up when many people had to crawl. To do so.
And it also talks a lot about the lack of preparedness at a governmental level, at a policy level, how, you know, doctors, ICUs, administrators were kind of making things up on the fly and having to make really life and death decisions here. Do you hope that government officials, policy writers are looking into this as well or reading this?
I hope so. I mean, you know, it was written again for all of us in terms of where do we go from here? You know, it's really hard when you're in the midst of a pandemic and the ground is constantly shifting beneath your feet, right? Which is what happened. You know, it was a virus of a type that we had known before, but there were so many unknowns and evidence kept changing. And I think the problem was it demanded a flexibility of mind and of approach to understand what the virus was showing us it was capable of doing and then how we needed to respond. And I think that flexibility is really hard. I think people did the best they could with the resources that we had. There were mistakes made, and, you know, hopefully this book will help us get better for the next time.
Yeah, I mean, and, you know, we have weekly conversations now. They were daily with Dr. Isaac Bogosh during the thick of the pandemic. They're weekly now, but again, he does remind us there will always be, unfortunately, another pandemic, you know, down the road at some point here. What you also get from the pages of this book, I found too, was the real frustration and anger so many in your field were experiencing here as well here. I found that really insightful and revealing about just how much, you know, sometimes you think doctors are being very clinical, but this was very human.
Yes, I think each of our authors really stepped up in terms of their writing and shared that humanity, shared what it was like to be a human in the midst of this, having these roles and responsibilities. And, you know, they were very honest about it. And I think that, you know, speaks to some of the things that we couldn't speak to at the time. And I think this book is very fresh in that way. And that's why it encompasses stories that are worth remembering. you know, how we dealt with the heartbreak and the loss, how we tried to innovate. And like I go back to how when we had nothing, we crawled to make it happen so that we could try to save as many people as we could. But we weren't blind to the effects of the lockdowns on people and the other losses that people experienced, you know, and I think, you know, what this book tries to point out is how we could work with the broader community as a healthcare system so that this doesn't happen the next time, so that we can bring more people in and we don't have that us versus them that kind of came out of this pandemic that I think has sort of been perpetuated through society now.
Are we, Doctor, in a better place at this point, 5 years on, than where we were, or do you still have a lot of concerns that if we had another pandemic, you know, tomorrow, God forbid, that we would be in a similar situation, that we would have similar frustrations and experiences?
I think there are going to be always some similar frustration and experiences. You know, again, that goes to the shifting nature of the pandemic and trying to mitigate its effects in real time. And I think those challenges are always going to be there. But what I hope that this book will do is that it'll provoke a discussion about, okay, let's look at these stories, again, from patients through to business providers and you know, how do we work better together the next time? And I think that's a discussion that really needs to happen now, or yes, we will be in the same state that we were.
Yeah, because I found this kind of a reality check, because here we are 5 years out, and some of us, maybe not as a doctor like yourself, but I look back at it, and was it as bad as I thought it was? You know, have I kind of like looked at it maybe through some slightly more positive, but when you really look at the reality, it was brutal.
It was brutal.
Awful.
Yes.
Yeah, so we appreciate this reality check. Thank you for joining us, Doctor. Thank you for the time.
Having
Thanks
me.
for this book,
pleasure.
especially on the 5th anniversary of COVID. So
I really hope people enjoy it. We're having a book launch at the U of T bookstore this evening from 6 to 8. Please feel free to join us.
Good luck with that. Okay, thank you so much. Great to meet you this morning. Thank you.